All right. So good afternoon, everyone. Welcome to Health Coverage Insurance and Financial Services. This afternoon, we have a number of language reviews. Before we get started, we will do introductions. Senator Hagan, welcome.
So nice to be here. Thank you.
Nice to have you.
But it's like a day off. They're spending money over there. I don't want to be. I'm Dave Hagan, Senate District 10, 12 towns surrounding Bangor, not Bangor.
Good afternoon, everybody. I'm Representative Mary Grace Chimino. I represent House District 83, which includes the towns of Bridgeton, Harrison, and Denmark.
Good afternoon, Representative Michelle Boyer. I represent House District 123, which is most of Cape Elizabeth.
Good afternoon. I'm Anne Marie Mastracchio. I represent House District 142, which is part of the city of Sanford and the village of Springvale.
Good afternoon. I'm Rolf Olson, District 86, which is Raymond, Casco, Fry Island, and a bit of Poland.
Good afternoon. My name is Bob Foley. I represent House District 145, which is most of the town of Wells.
Good afternoon. My name is Christy Matheson. I represent District 151 in Kittery and I serve the House co-chair.
And I am Donna Bailey. I represent Senate District 31, which is Buxton, Old Orchard Beach, and Saco, and I serve as the Senate co-chair. So Colleen, whenever you're ready.
So I think there's 10 amendments, letters, final amendments in this packet. They're collated for you in alphabetical order, in numerical order. So if you want to just go down the line,
Yes.
we can go down the line.
Yes.
So the first one is LD 1803. Committee members might recall this is a divided report. There's a majority and a minority report. The voting sheet is attached for you on the back page. The majority report supported by 7 members of the committee. It's split up into 2 parts, Part A and Part B. Part A are the changes that are intended to be made to the laws governing optometry practice based on the sponsors amendment that was supported by the majority of the committee. Those changes would take effect January 1 of 2028. Part B of the amendment is the study that the sponsor put forward to the committee and adopted by the majority. That is a study that would be focused on a review of the State Board of Optometry, looking at the adequacy of staffing, the adequacy of funding, and the adequacy of legal assistance. That would be intended to take effect 90 days after the legislation was enacted if it moved forward. But Part A, which are the statutory changes, would take effect January 1 of 2028, as I understand it. So just kind of going over for you quickly the changes in the majority amendment. This is presented as a strike and replace of the bill, so you can see all of the language in front of you. So Section A1 would add a definition of the practice of optometry. Section A2 would provide specifics about the practice of optometry, including the specific services and procedures that would be permitted. So the substantive sort of focus, I guess, of the committee's discussion of LD 1803 was really on subsection 2, which were the services and procedures that would be permitted to be performed by optometrists. So if you see, really all of those are included as reflected in the sponsor's amendment. Subsection 3 sets forth those things that would be excluded, those types of ophthalmic surgical procedures that would be excluded. Subsection 4 at the bottom of page 3 sets forth a requirement that persons may not perform surgery or laser procedures unless the person is satisfied credentialing requirements established by the board. It does put in place some minimum credentialing requirements. Section A3, it requires that the board adopt rules to further define the practice of optometry in accordance with those subsections that I mentioned. Section A4 and A5 are really technical changes. Grammatical changes. Section A6 adds to the authority of the Board of Optometry the ability to issue advisory opinions and declaratory rulings. Section A7 is a rulemaking provision It requires that any rules relating to the scope of practice are major substantive. Other rules would be routine technical. Section A8 removes a prohibition that was in place related to the ability of optometrists to use pharmaceutical agents by injection. Section A8 is, A9, excuse me, is a section that adds a requirement that licensees carry malpractice insurance as established by the board. Section A10 is a provision that relates to record keeping with regard to contact lens prescriptions. It extends the requirement in current law from 5 to 10 years and requires that dispensing parties, if they're not an optometrist who has an optometrist-patient relationship, must forward a copy of the details of the prescription to the optometrist that has that relationship with the patient. Sections A11 and A12 make some technical changes to reflect other changes in the bill in terms of expanding the scope of practice of optometrists. So this is the majority amendment.
Yes. Questions?
The minority amendment, the biggest change is the list of permitted procedures that would be allowed to be practiced by an optometrist. Two things I wanted to call attention to the minority, though. One is in paragraph B, in the definition of ophthalmic surgery. There was a suggestion, you see some italicized language that clarifies that surgery includes procedures using photosensitizing chemicals. That was a suggestion that was made by eye physicians and surgeons. I wasn't sure if that was something that you wanted to include or not. That's something to, because I think the intent was to include only things where there was an agreement, but that was a change in that definition. So I wasn't sure if that was intended to be included in your motion or not. But in the provision subsection 2, which sets forth the procedures upon which there are agreement, it eliminates a number of the paragraphs that were in the majority report. So you'll see there are paragraphs A to L set forth in the minority amendment. And if you look at the majority amendment, it's paragraphs A to S in terms of listing out the procedures. I would point out under the minority amendment, the ability of an optometrist to perform surgery is limited in paragraph L to 2 specific types of procedures. And there's a broader authority granted in the majority amendment. Also as an alternative to subsection 3, in the majority amendment, it lists out, the surgical procedures that are excluded. In this version of the amendment, simply stated that any surgery procedures not expressly described in subsection 2, paragraph L, are excluded from the practice of optometry. And in subsection 4, with regard to credentialing, it would require that credentialing standards be set forth in rule that would be adopted by the board. Those rules would be major substantive. And then also adds language that says that a person may not perform surgery in accordance with subsection 2, paragraph L, until the board has finally adopted rules in accordance with subsection 4, section 19-103 and section 19-204. That is in place to require that until major substantive rules are adopted, an individual would not be able to perform the surgery. It's just more, much more explicit in terms of the authority of an optometrist to engage in those practices. Section 3 of the amendment states that any rules adopted by the board related to the scope of practice would be major substantive as well. It does not have sort of in the majority report, as I just explained it, the initial rules, the rules related to scope of practice would be major substantive. Everything else would be routine technical. This would designate all the rules as major substantive under the minority amendment. Sections 4, 5, 6, are the same as in the majority amendment. And then and also, in section 7, it just specifically says that rules relating to scope of practice and, rules relating to scope of practice and credentialing standards are major substantive rules. This would allow other rules to be routine technical. Sorry, I've messed that up, but that's something for you to consider whether or not you wanted to make all the rules major substantive or just those 2 specific categories with regard to credentialing and scope of practice for those who are on the minority amendment. And then finally, rest of the provisions are the same. It also includes a requirement that licensees carry malpractice insurance because that was where there was agreement. The mention I made about the record keeping related to contact lens prescriptions are the same. Those last changes in section 11 and 12 are the same, the more technical changes. And then in section 13 of the minority amendment, that's a study as well, but it's a different study in terms of the scope of what would be asked of the members of that study. As you'll recall, this is based on Representative Mastracchio's suggestion. So it would essentially require kind of a 2-tier approach or 2-stage approach to making suggested changes to the legislature. The task force under this proposal would be tasked with looking at structural and administrative changes to modernize board oversight and changes to update the licensure and scope of practice provisions for optometrists. That may go beyond what was in the first part of the bill that we just talked about. Under the timeline that's set forth in the minority amendment here, the task force would be required to report back to the HCIFS committee next February. The committee would be authorized to report out legislation in the first regular session related only to the task force recommendations to modernize board oversight and to continue the task force process. And then in the second regular session, the committee would be authorized to report out a bill looking at any updates to the licensure and scope of practice provisions for optometrists. So that's what I think you all voted for.
Representative Mastracchio.
Thank you, Madam Chair. So the minority report, that photosensitizing chemical, I'm trying to remember, I don't remember specifically, was that a thing that we were in agreement on? Because this is, we didn't have it in there in the beginning, I'd say,
It wasn't something that was agreed upon. It was just a clarifying change
Yeah.
that was suggested. So,
yeah, I.
but I wasn't sure. So I think
I don't think I-
based on your motion, I don't think it would be included. I just had that question. So, yep.
Any other questions? Representative Clucci.
Just clarifying, Colleen, on the task force for the minority report,
Yes.
because it has legislators on the committee, would it not start until the next legislative session begins?
No, both task forces have legislators on it.
So you would have to,
So they would be appointed with, neither of these proposals are right now are emergency legislation. So they take effect 90 days after the legislative session ends. So then they would be appointed and be asked to start their work. Not dissimilar to other task forces, commissions that have been established in the second regular session. Sometimes they don't start until, the fall. And they would be, they would do what they could to meet the timelines, but yeah.
so then then when you reconvene in the next legislature, do the leadership then appoint new members if, say, the members
So
are no longer there?
under the minority amendment, that's partly why you have it's a 2-tier kind of approach. So under in the language, it says in the first part of it, it would require a report back in February. And then the committee or the task committee would be able to report out a bill to make the changes they recommended and to reestablish the task force. Because you have to do that because it would be a new legislator.
Okay.
Yeah,
You- I
legislature.
know you would have thought of it.
Yeah. So there would have to be new members and everything under the minority amendment proposal because we're spanning 2 legislatures from the 132nd to the 133rd. The majority amendment just has a one-time report back to the next legislature. Yeah.
Unless, of course, all the House and Senate members get reelected. Representative Foley.
Thank you, Madam Speaker. I'd like to ask if we can reconsider our vote on this. Unfortunately, I was not here physically and was doing this via Zoom. And there were a couple of amendments or changes I wanted to make to the majority report that I didn't get a chance to make. And so I was hoping that we could reconsider it. And I can put those amendments and those changes in. Bill.
So is that a motion?
Yes, please.
So there's been a motion to reconsider, seconded by Representative Chimino. All those in favor? Okay,
Was that unanimous?
no, I think there was one against.
One,
Yeah.
That'd be nine. Okay, I'm just making sure how many people.
Okay,
Thank you.
so we'll reopen the work session on LD.
Do you have a voting sheet? Are you good? Yeah. Okay, yeah. I do think Senator Baldacci said he wanted to be here, so Andy was involved.
That's fine. Yep, yep. So opening the work session on LD 1803 and Representative Foley, what were the,
Yeah, on page 2 of the yellow sheet, I wanted to exclude the procedure O, the corneal cross-linking, and under P, number 4. And I'd also like to put a sunset clause on the bill to have it sunset 5 years after it becomes effective. That way the committee can get a chance to review, take another look at it, see if what's happening with it and if there's any changes that need to be made after the board, after the study's done. So those are my changes.
Yeah. 2030, right? So 2028 plus 5 years. So you would sunset in January 1, 2033. So that would. Okay, just because repeals are difficult, and I might not even be here then.
oh, no, you can't
I probably
retire
won't be,
ever.
because that's a long way away. I might suggest, what I think is very helpful when you have a repeal date like that, since the report date is gonna come sooner than that, is to have some sort of trigger in the session prior so that the committee would look at it. Make an affirmative decision. Otherwise, this is just gonna self-repeal on January 1 of 2033. And sometimes you get, sometimes you miss it. So I might build in some sort of like report back from the board or some recommendation whether or not this should get continued or what changes would be,
I just want
just to trigger it. Yeah.
I just want to make sure
Okay.
that there's enough time
Yep.
for it to be in place so that we will have, there'll be information that,
Yeah. I mean, I know people be tracking it, but it has happened where things get repealed, the legislature misses it, they have to reenact it. And I wouldn't want you to be in that situation where all of a sudden this whole thing goes away if someone missed it.
yeah, so whatever language you
Okay.
think works best.
Yeah.
But that's my intent is to
Yep.
give it some time and then have it reviewed again.
Okay. And then just to confirm, we're gonna strike corneal collagen cross-linking, and then strike, the only thing you're striking under paragraph P is just for the excision of a single epidermal lesion.
Correct.
Okay, thank you.
Further,
Thank
just,
you for allowing me to.
sure, no, I always want people's vote to reflect what they really want to vote for. That's important. Any further discussion? And then do we have a motion? We have to revote. Yeah.
I'm going to
Representative
make a
Foley.
motion to move the majority ought to pass report as amended.
And seconded by Representative Olson. Further discussion? Seeing none, I think we're ready, Edna.
Thank you. Senator Bailey,
No.
Senator Bailey, I'm sorry, no?
No.
Senator Bailey, no.
Sorry.
Representative Matheson,
No.
Representative Matheson, no. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Boyer,
No.
Representative Boyer, no. Representative Shamino,
Yes.
Representative Shamino, yes. Representative Clucci,
No.
Representative Clucci, no. Representative Flynn,
Yes.
Representative Flynn, yes. Representative Foley,
Yes.
Representative Foley, yes. Senator Hagan,
Yes.
Senator Hagan, yes. Representative Mastracchio,
No.
Representative Mastracchio, no. Representative Olson,
Yes.
Representative Olson, yes. 6 members of the committee having voted in the affirmative. 5 in the negative, and
Negative would be the original minority report. Yeah. To pass as amended.
No changes.
No.
Okay.
Okay,
Thank you.
all right. Next.
Okay. All right, next one is 2056.
Yes.
Committee had seen this language, really, most of it at the first work session, so I just marked this up. But you'll see on the back, would be the changes to this amendment. In paragraph C is the new language to address those, loan transactions. It would clarify paragraph C to read a consumer credit transaction secured by an automobile that has not been previously owned. I think it should say owned or titled by any consumer.
Yes, title. Yep.
Owned or titled. It was suggested that I keep owned in there. So owned or titled pursuant to a schedule of payments under which scheduled payments are not substantially equal, but no payment is more than 36% greater than any other payment.
36.
Representative Clucci.
Just wanted to say that I heard that from the credit unions that they didn't have an opportunity to or they weren't prepared to testify, but they didn't love this. I also don't know if anyone had a chance to read the article that I had shared from Edmunds, and maybe wanted to reconsider their vote.
So just to clarify, so that, yes, that's why we put this off for a week, because the credit unions had asked to look at it. My conversation with the representative, oh, she's here today, was that they were still doing research. Yeah, tell me if I misrepresent what you told me, that they were still doing research. They still had some concerns. And if they found anything in doing their research, that they would share it with committee members and other legislators, but that they had not found anything at this point.
Okay.
So. Representative Matheson.
I was wondering what the appetite of the committee would be. This 36%. I feel like that's a high number. I felt like it was a high number in the beginning, and does the committee have any appetite for lowering that percentage down to 20%?
That's a big jump.
It is a big jump.
Yep, yep. Okay, I thought you were gonna say 25%, so, but
Well, you can
yeah,
negotiate terms. And if you do the math, if a loan is $600 a month, let's just do the math on that. That's an increase of $216 a month, which seems to be significantly greater than what the example was given to us during the public hearing. So I just felt uncomfortable about that percentage. Is there any wiggle room with the committee considering lowering that percentage? Don't all jump up at once.
120. So, yeah, in doing the math, I mean, the 20% and Representative Foley, I'm going off your point, which I thought was a legitimate one, that those lower payments kind of help offset the excise tax, which is considerably high, having just bought a car last year, I can attest to it. And just had to re-register it, so I've had it just 1 year and it was still high. So at 20%, again, using a $600 a month, that's 120 per month, which would be just about what the excise tax is. So that's not a crazy amount if we're trying to just kind of offset that excise tax. So I'm open to discussion to lowering it. I'm not wedded to 36%, but I don't know what the rest of the committee thinks. Thoughts, Representative Foley?
I know these funds.
I know.
I mean, the only concern I have is that a consumer can go across the border and do this now.
Yeah,
And our dealerships here are at disadvantage not being able to offer.
Yeah.
I mean, they do it at 50%, so at least the 36% still keeps them in the game, so to speak. I think for some, would be a valuable way for them to, to get a new vehicle, and be able to, start out with a lower payment that helps them with all this. I mean, your insurances go up, your excise tax goes up, everything goes up when that new car comes along. So that's my big concern, is that I really don't want to put our dealerships at a disadvantage, but that's just my thought.
and thank you. I didn't realize New Hampshire had a limit of 50%. So we're still lower than New Hampshire, which is interesting. Yeah. Which is not unusual. We tend to be a little more protective
Consumer
of consumers than New Hampshire in general. Representative Olson. Well,
Free to die.
yeah.
I think it's important to remember too, that this is an option after they've been qualified for the full value of the loan anyway. And this is just an option that they have, that you can go this way or you can go this way. You've already been approved at the full value of the loan. So they're at the same risk, as far as being underwater after a certain amount of time, either way. So they're not, it's just giving the consumer an extra, one further option, but they've already been qualified for the full value of the loan.
Okay. Representative Matheson.
Right. I understand that and I appreciate that. Thank you. And I also appreciate what you said, Representative Foley, about state to state. I have to say that I'm still concerned about this loan process. I think that it puts consumers at a risk, but I won't push it anymore. I wanted to see whether or not the committee had an appetite to lower that. So it sounds like probably not. So thank you for considering it, though.
Thank you.
Is LD 2071. The only change from the amendment that the committee looked at the work session was to retain the references to the advisory committee on immunization practices and make it an either or. So either the advisory committee on immunization practice or have been licensed by the Federal Food and Drug Administration. So you'll see that change in section 1 of the amendment and also in section 3. So 2071. Oh, I'm sorry. I hoped they were in order, but maybe they got messed up. Sorry. They get messed up?
No.
Oh, okay. Are you missing 2071?
No, we haven't.
Maybe I missed it for Representative Mr. Akio. Here you go. I might have missed it. Edna could see me. I was trying to do it this morning, so I needed her guidance probably, so I might have missed it. So you'll see that reference has been retained in section 1 and then also in section 3 of the amendment. retain that reference to the Advisory Committee on Immunization Practices, but also include the reference to recommendations of the American Academy of Pediatrics, the American Academy of Family Physicians, or the American College of Obstetricians and Gynecologists. So that's LD 2071.
Great. Okay.
That's great. The next two on salmon are the final versions, which are ready to be hopefully reported out soon. So you've seen the substantive language of these already. You hadn't seen the completed fiscal review, which for both of these amendments just show that any additional costs to DPFR or to the Office of Occupational and Professional Regulation within DPFR are expected to be minor and can be absorbed within their existing budgeted resources. LD 2074 relates to licensing of social workers, and 2087 relates to licensing of American Sign Language interpreters. Both of these amendments are emergencies.
Okay.
Okay. The next one on green, this is, you had previously looked at the amendment, the minority amendment to LD 2088. You might recall the majority report is ought to pass. The minority amendment ought to pass as amended from Representative Clucci and Representative Arford. My understanding, they've reviewed that amendment. They are comfortable with that language. But the committee had, when we talked about this last time, talked about sending a letter asking the licensing boards and the affiliated boards to review the information that they currently have about licensed healthcare practitioners in clinical practice, whether they're active and where they're practicing. Because right now, I think the committee has noticed a gap in the information that they can provide. They can provide the actual number of licensees, but they don't necessarily know if those licensees are actively practicing and where they're practicing. So this letter seeks to ask the boards to take a look at what information they currently have available, consider whether or not they can make changes to their current process to gather this information, or whether they need additional statutory or regulatory action in order to gather this information. Because there are so many licensing boards that license various healthcare professionals, I think the committee was interested in finding out about all of them. This letter is drafted to the Commissioner of the Department of Professional Financial Regulation, asking that the Commissioner coordinate with the licensing boards that are overseen by OPOR within the department and the affiliated boards with the department to gather this information. So this is my first attempt, asking them to report back by January and go from there. If there's a different timeline, we can have a different timeline. I thought about suggesting an earlier timeline so that if anybody's returning next session and there needs to be a statutory change, you could put a bill in. Committee would all, even though this is by a letter, the committee may have authority to put a bill in or amend an existing statute, but you might want to think about the timeline. So.
Yeah, no, I think the timeline is fine. So, yeah. Any other comments from committee members on the letter? Representative Clucci.
I'm just curious whether anybody would be willing to request that the board be able to ask what type of medicine are they practicing, whether it's like the health employment screen, or whether it's like the insurance screenings, or whether it's like the estheticians, or, just so we have a sense of is this meeting the objective of getting people into primary care in rural areas?
Yeah, I don't know that the letter was specific
I
about
was
the
just gonna
type
say
of.
it's a little broader
information.
than
It's
that, but
broad.
I think it's intended to ask,
Broad.
not necessarily just applied to physician associates, but to have all the boards look at what information they ask about from their licensees to gather information about where they're practicing and in what settings. So I think it gets at a little bit of what you're talking about, like the settings that they're practicing in and the demographics. So if we need more specifics, but the idea I think was to find out, A, you have a license, but B, are you in active clinical practice? where are you practicing and what are you practicing? That's sort of what I think the letter's trying to get at. If there's something we're missing, let me know. But it was intended, I think, to be broad, to apply not just to physician associates, but doctors, nurses, clinical,
And also-
psychologists, everybody in the healthcare workforce, dentists, everybody, because it comes up over and over again, I think, for the committee, is to try to get information about who's practicing. And the boards can say, well, we have 50 licensed psychologists, but you don't know if they're all 50 employed and where they're working.
And it's.
Is that right?
And it's intentionally broad because I think we're gonna find it's going to be a mishmash from all different boards in terms of what they collect. And so I don't want to limit them. I really want, what I want is for them to tell me, what information do you collect? Because that's going to be our starting point in terms of here's what we need in addition, or how we need to structure it or whatever. Yeah, I guess that does help me think of the one missing piece is just that I did want,
More clear about what they get now.
well, what they get now, but again, any suggestions for gathering this information and the best way to do that, whether it's through the licensing process renewal or are we reporting information to MHDO or otherwise? Something like that.
Yeah.
Yep.
You do that.
Anything else? Representative Clucci.
Thank you, Madam Chair. I just wanted people to be aware that on the language for the minority report, we worked, Rep. Arford and I worked with Dr. Terranova to just try and flesh out what we were actually sort of looking for and what our amendment would really sort of end up being. And right now, they have this thing called there's a form that the independent practitioners have to fill out when they open their practice. And this is the practice agreement form, right? And it has some information. I'm happy to circulate it. But what we would be essentially doing is changing this to just be a notice. So they would be providing notice to the board of what their independent practice, and the piece that that they already collect now, but they would also, that they would continue to provide, it's just what's their scope of practice going to be, and just to document their training, basically to give them their resume, to just have it on file. And so if anybody is interested in, reconsidering and joining on the minority report, that's tangibly what our amendment looks like, is that they would just provide a notice to the board of what it is that they're going to do.
Okay. Anything else on the letter? Okay. Great. Next.
2129 is next. This is an act to prohibit liens on principal residences and wage garnishments for medical debt. The first section is my attempt to get at the issue that Representative Olson brought up, which was to prohibit the accumulation of interest for those attachments that took place prior to the enactment of this legislation. So this is a change to a provision in statute in the chapter of the Chapter 14, which governs executions and writ of executions. And there's a current law that says that allows interest to be collected from the time of judgment. So I think this is the right place to do it, but I've also been consulting with, I've been phoning a friend in my office,
Yeah.
for the Judiciary Committee staff.
I was
So
gonna say
we're-
Oprah for
we're
judiciary. Yeah,
we're
yeah.
working on it, but we think, this so the placement might change. But I think this gets the idea in front of you that, and when we notwithstand anything else in statute and say that interest may not be collected upon execution of a judgment related to disposing of property subject to a lien or attachment of a debtor's principal place of residence based on their medical debt, for any amount of interest that is accumulated on that debt subject to the lien after the date on which the exemption on attachment and execution pursuant to, which is enacted in the legislation, takes effect. So I think that's your concept. And if that is your concept, I think we may, further tweak the language, but that's the idea.
Yep.
Okay. And then the second change is in section 6, and that is just notwithstanding the current provisions in statute that allow certain amount of the value of a debtor's residence to be excluded from attachment. The intent of this legislation would be to exempt all of the value of that debtor's principal place of residence from attachment and execution based on medical debt.
Looks good.
Okay.
Thank you.
Yep. Right. The next one is LD 2146. This was Senator Daughtry's bill. The only change here, you had seen this amendment prior when you voted it at the work session, but at the suggestion of the Department of Health and Human Services, we moved the substantive language, which is at the bottom of this page, related to the ability of the Maine Vaccine Board to request additional funding to a different, to its own subsection, rather than within an existing subsection of statute. So it's the same language. It just puts it in a new subsection 4A rather than as an additional paragraph under subsection 3.
Okay.
Or subsection 5, I should say.
Yeah.
The next one is LD 2189. This is the bill related to notice of termination of changes in maternity and newborn care services. This is really just a technical change, reallocating the substantive provision to another chapter of Title 22. You remember, I asked you to reconsider in order to add this technical change. This just shows you, we're just putting it in, enacting it as section 1822B instead of 332A. Moves it to the right chapter.
Nice.
The next one is LD 2200. This is really just the same language that you saw when the committee voted on this at the work session. I think I might have cleaned up a typo that was in there and a typo in the title because I was missing a between in there. But otherwise, this is the amendment that preserves the ability of non-compete agreements, but requires that any non-compete agreement between an employer and a healthcare practitioner that is enforceable must recognize an individual's right to choose their own healthcare practitioner. So this is a divided report. The majority report is ought to pass as amended. Minority report is ought to pass. Okay, you'll see that there.
Yep.
I think that was it.
Why do we have more? Oh, maybe they were these ones.
What do you have? Did you get? more?
Oh, yeah, they were the salmon ones.
Oh, yeah, salmon ones. Yeah, okay. Yep. Those came after. So I think that's all I had.
Okay, anything else? All right. Well, we will see you tomorrow
Thank
at
you.
10 o'clock.